Thank you for subscribing to this channel. This is a Reading Part C practice video.
What is the manual informing us about blood pressure monitor? Now, if you read the highlighted section, you will understand that in simple terms, this means that the device has been designed and tested to ensure that it can operate safely and effectively in the presence of electromagnetic fields generated by other devices. However, the line also cautions that despite the device's compliance with the standard, it is essential to take care when using the monitor within 7 meters of cell phones or other devices that generate strong electrical or electromagnetic fields. This caution is because even though the device meets the standard, it may not be completely immune to electromagnetic interference, especially from strong sources. As a result, it is necessary to take precautions to avoid any potential interference that could affect the performance of the medical device. Therefore, option B is the correct answer. Option A is incorrect because the manual does not mention the blood pressure monitor interfering with the operation of other medical equipment. Option C is also incorrect because the manual only addresses the EMC requirements for the device and does not state that it is safe to use in all hospital environments.
Let's look at the next question.
Option C is correct in this case because the notice is providing information about which staff should perform ING tube placement. The notice states that insertion and care of an ING tube should only be carried out by a registered doctor or nurse who has undergone theoretical and practical training and is deemed competent or is supervised by someone competent. This information highlights the importance of having qualified and trained healthcare professionals involved in the insertion and care of ING feeding tubes. The notice also mentions that assistant practitioners and other unregistered staff must never insert ING tubes or be involved in the initial confirmation of safe ING tube position, emphasizing the need for trained and competent staff for this task. Option A is incorrect because the notice does not provide information about ways of checking that an ING tube has been placed correctly. Option B is also incorrect because the notice does not address how the use of ING feeding tubes is authorized. It focuses on the proper training and competence required for healthcare professionals involved in ING tube insertion and care.
Let's look at the next question.
Option A is correct because the passage states that all staff involved in the transfusion process must ensure that their competency assessment is updated every 3 years. This implies that they need to check that their existing training is still valid to ensure they are up to date with the latest standards and practices. The passage also mentions that all staff are responsible for ensuring that they attend the mandatory training identified for their roles, which further supports the idea that staff need to check that their existing training is still valid. Option B is incorrect because the passage does not mention that staff need to attend a course to learn about new procedures. While the passage does refer to mandatory training, it is not specified whether this training involves new procedures or updates to existing ones. Option C is also incorrect because the passage does not explicitly state that staff must read a document that explains changes in policy. While the passage does mention the right patient, right blood, safety policy, it does not specify that staff must read a document explaining changes in policy.
Let's look at the next question.
Option B is correct because the extract mentions that it is the healthcare professional's responsibility to evaluate the need for a chaperone on a case-by-case basis. The guidelines emphasize that a chaperone may not always be required and that it is a question of using professional judgment to assess each situation. This implies that the healthcare professional should consider the patient's specific circumstances and the nature of the examination or investigation before deciding whether a chaperone is necessary. Option A is incorrect because although the guidelines acknowledge that a patient may specifically request a chaperone or nominate one, the responsibility for offering a chaperone should not be solely on the patient. The healthcare professional should also evaluate the need for a chaperone based on their professional judgment. Option C is incorrect because although the healthcare professional should respect the patient's wishes, the guidelines emphasize that it is their responsibility to evaluate the need for a chaperone and make a professional judgment based on the individual situation. Respecting the patient's wishes does not necessarily mean that a chaperone should always be present, as the need for a chaperone should be evaluated on a case-by-case basis. Option A is correct because the guidelines require those undertaking a clinical medication review to involve the patient in any decisions made as a result of the review. The guidelines state that patients should have the opportunity to raise questions and highlight problems about their medicines, and any changes resulting from the review must be agreed with the patient. This indicates the importance of involving patients in the decision-making process and ensuring that their views and opinions are taken into account. Option B is incorrect because there is no mention of considering the cost of any changes in treatments in the guidelines. While it is important to avoid the waste of prescribing and avoid ineffective treatments, this does not necessarily mean that cost should be a primary consideration in medication reviews. Option C is also incorrect because the guidelines do not recommend other services as an alternative to medication. While the guidelines do emphasize the importance of engaging in the prevention of ill health and proactively managing patients to recovery, this does not imply that medication should be replaced by other services. The correct answer is B. The purpose of this email is to explain the background to a change in patient care. The email specifically discusses the safe use of opioids in hospitals and the need for continuous monitoring of post-operative patients. It does not report on a rise in post-surgical complications nor remind staff about procedures for administering drugs. Option A is incorrect because the email does not report a rise in post-surgical complications, but rather it is a warning about the incidence of respiratory depression among post-surgical patients and the need for continuous monitoring. Option C is incorrect because the email does not remind staff about procedures for administering drugs, but rather it is about the safe use of opioids and the need for continuous monitoring for post-operative patients.